We're about to jump in today's podcast, but before we do, I have a favor to ask you. If you listen to this podcast weekly on Apple or Spotify, could you please follow the show? That would be so appreciated. I'm so grateful for your time and your energy because this will help the show get more traction, which means more people can benefit from it. And if you would be so kind, if you're on Apple Podcast, to leave a review, it would so help the show out. Thank you so much for your support. Let's start the show. Today's show is a little different. I have a third-year TCM student asking me questions, kind of like a little reverse interview. You are going to love her insightful questions, and I truly hope my answers benefit you as much as it benefited her. What did we talk about? We looked at how TCM views emotional trauma. We discussed how to approach and support patients who have experienced emotional trauma, including sexual abuse. This is a sensitive subject, so be warned that it might not be for everyone. We also talked about treatment, including the 3 best ghost points for those who have experienced emotional trauma. This episode is packed with great advice you can apply in your practice today. By the way, if you haven't signed up yet to my free TCM and mental health online course, the link will be in the show notes for you right below. Make sure to enroll and watch it. It's completely free and you'll benefit from it immensely. Welcome to Acupro, a show dedicated to making Chinese medicine and acupuncture easy to grasp and fun to learn. Hi, I'm your host, Clara Cohen. I support practitioners and students in changing the world one patient at a time. My goal is to share my passion for TCM and empower you to achieve superior patient care. I love to showcase the amazing benefits of acupuncture because, after all, acupuncture rocks.
I'm still in school doing traditional Chinese medicine. Something that I want to focus more in the future is women's health, but especially people who experience trauma. My first question is from a traditional Chinese medicine perspective. How does trauma, especially sexual trauma, affect people's reproductive health, whether for women or men?
That's a great question. You know, in TCM, it's been said that 70% of all chronic disorders come from longstanding emotional stress or emotions. And those emotions could come from trauma, right? It could come from intergenerational trauma as well. And that's been proven more and more. Emotions, when they've been there for a long time, they can literally change the body at the cellular level. So people that have experienced trauma and not processed it, it is going to stay inside the body and fester and change the body at the cellular level, unfortunately. So now when it's affecting the reproductive system, let's say sexual trauma for a woman, as a child, for example, when we were children, years are the 8 vessels. We look at the 8 extraordinary vessels as each 7 years, each part of our growth from birth to our first 7 years, second 7 years, and third one until we're 21. And then after that, we're adult. It really relates to the vessels. So the vessels which connect to essence, and essence connects to kidney, and kidney connects to fear and shock and trauma, will get affected. So shock, trauma, repetitive fear of being abused again, let's say it's years of abuse or weeks or months of abuse, or fear of being abused again because it happened that one time, that will affect the kidney. And it will definitely deplete the kidney. And the kidney in TCM is really connected to the reproductive system. So that is always going to affect essence, kidney, reproductive system. If the reproductive system was the one that had experienced the trauma, it will affect it. So for women, it could be irregular menstruation, amenorrhea, it could be dysmenorrhea, it could be fertility issue, as well as breast area as well, because it's also part of the reproductive system, specifically for women, because they do breastfeed and it's part of the system as well. And the Chong vessel relates and crosses the stomach meridian, which goes to stomach 17, which is the nipple. And so those areas get affected as well by emotional stress and emotional trauma. For men, if that's the case, it will affect more their lower jiao. For women, it's also obviously the lower jiao, the uterus and all this. But For men is going to be kidney as well, because trauma, again, is shock, it's fear, right? So kidney as well, for sure. Essence will be affected. But for men, it's going to be the lower GI. So they may have issue with prostate, reproductive system, anything that has to do with genitals, but also with the rectal area. So maybe rectum or large intestine or some bowel issue. If it's sexual trauma for men, it's going to affect more than just their genital. It's also going to affect the organs around it. So it's a little bit different than the women. Women could have some issue with large intestine, but it will affect their reproductive system a little bit more just because it's such a bigger system and it gets affected. Obviously, there's other traumas that are not sexual related that can happen to people. Like, for example, you give birth to a baby and that baby dies within a few hours. That's a shock. That's a trauma. That's a big trauma because you lose your baby that you thought you were going to, have a great life with. That is going to be a shock. And again, depletes the kidney and create fear now, because can you get pregnant again and have a baby? That next pregnancy, you're going to be in fear all the time. So it might, be a self-preservation where your body just doesn't want to get pregnant anymore. So it makes it a little bit more difficult the second time around. Acupuncture can be very useful to release all this, but also counseling is very important as well, because people need help processing. They can't do it on their own. It's very difficult, right? So often that's really important to have. And, when you explain that to patients and you say, if it's not physical, it's emotional. And sometimes people don't know what it is because they don't remember, maybe because they blocked it.
I also understand that this is very sensitive topic. It's first time visiting your clinic and it's very difficult to talk to about trauma right away. How should we approach our patient so we can treat them well?
That is a great question because it's not easy, and you're absolutely right. So when someone's going to come and see you, 99% of the time, they will never share their trauma with you because they don't know you. They don't know if they can trust you. They haven't built a relationship with you. Imagine that some people don't even share their trauma with their spouse or their best friend ever. That's happened to me. One of my best friends, I never knew that she was sexually abused by her dad and brother when she was growing up. And I had no clue until she told me that years into our friendship, years. And so people don't share this easily. And I was her friend. Imagine a practitioner, right? They're never going to share that on the first day. However, you can explain to them and start slow. I always talk about emotions at the end when we spend a lot of time talking about other things. Don't start with that because that would be way too strong. But then I'll start with little things like, are you a worrier? Do you overthink? Do you like to be in control? Do you get irritable easy? Do you have anxiety, right? Do you feel like blue or depressed sometimes? Tell me how you feel inside emotionally. And people can share. They'll share, oh yeah, I'm a worrier. I've worried all my life. So you can see there's some emotions, and that's a first start. And then they come back the week after. That's when you can educate and say, because your problem doesn't seem to be physical, then if it's not physical, it's emotional. So you don't have to share with me, but look into what could be the cause that's something that you haven't either processed or you're not willing to go to yet, or it's something that really has been festering for years and you're just not dealing with it for many reasons. Think of that because that could be the problem, right? And sometimes people will say things to me, oh, I've been literally fighting with my mother who doesn't understand me since I was a little girl. This is years and years of her not feeling loved by her mother. If there is a problem with a parent, it always affects the sexual reproductive system because we come from the wound. And when it's the mother,
Really?
yes, specifically if it's a girl and her mother. Yeah. So her girl and the mother, the connection is very strong because we both have the same organ. So there is going to be some issue with the reproductive system for the women if there is a lot of issue with connecting or loving from a mother-daughter relationship. And that often will result in irregular menstruation, dysmenorrhea. I see that in practice all the time. And people are easy to share that because it's not a trauma. It's more something that they're dealing with on a constant basis. And so it's helping them going, okay, you either both can go to counseling together and try to mend this relationship, but You can't force someone. If the mom doesn't think there's a problem and she doesn't want to go, you can't force them. So then you will have to go and deal with the fact that I'm loved by my partner, my friends, my family, everybody, not my mother. How can I handle this and feel still good enough and a beautiful person, right? So they have to do the work. At the same time, you can help them connect to their inner woman because that's the child in them, their inner child.
Amazing. Sorry to cut you off.
No,
It's actually amazing how traditional Chinese medicine can connect little things, and it can affect you like your digestive system, and it can affect your emotional. When we look at in a conventional medicine, an example, you have amenorrhea and they will always say, oh, you have PCOS or you have endometriosis. But what's behind it? It's just amazing that we are able to explain what is the root cause and how can we move forward or how can we change things.
There's always a cause, and TCM can always look for the root cause, no matter what the disorder is. Doesn't mean it can cure it, but there's always a cause. And so people really feel empowered when someone actually show them that, oh, okay, so that's the cause because, it's unknown. Nobody wants to be told it's unknown. So you're absolutely right. For men, if there was issues with the father, and not a connection, which is very common with men and their father, depending if the father was very strict or hit them when they were younger or never understood them or just treated them not with love. Because that's a man thing too, right? The man's got to be strong. If you were a young boy and you cry and your dad told you, oh, just stop crying, boys don't cry, then you're like, okay, well, I can't cry, right? So with men, if there's a disconnection with them and their father, usually it always results in anger. It'll come out as anger and it'll come out as spine issue, low back pain, upper back pain, and anger. Men have tendency to be more yang, women are more yin, right? So anger is a yang emotion. Women have tendency to be more yin, more inside, like keep it inside. Doesn't mean that men don't do that. It's a general idea, but a lot of time for men, if there's a disconnection with the same gender, their father, it's spine issue or back issue and anger.
What if patient is untruthful about what they feel or what they are going through? Because it's when we are doing diagnosis, it's very important. And what if they are very untruthful about it?
So you have to educate patients because they don't always know, right? And they might not be truthful because they do have fear of judgment. Sometimes I see that because I'll ask patients and say, just the physical stuff, right? Oh, okay, so how's your bowel movement? Do you have a bowel movement every day? Yeah. So when they say, yeah, and there's no detail, I stop them and I go, that's great. Just so you know, the more detail I have, the better I can help you. So if you feel like most of the time your bowels are formed, not smelly, there is no sticky stool, it's finished, no sticky stool, it's formed bowel all the time. And they're like, well, no, it's sticky. I'm like, okay, that's great. Give me more information, right? The more I have, the better I can help. So I always make sure I educate the patients on that. And then the normal thing. When I say, oh, do you have headache? Well, yeah, like everybody else. So if you have headaches once a month, is it around the period? If you have headaches once a week, what's going on? Let's look at it. So maybe you have it once a week for your last 10 years, so it is normal to you. However, it shows something is not quite right because you shouldn't have. So let's look at it. The more information I get, the better. So that's awesome. Please tell me all those things. And then they're like, oh, okay. And then they start sharing, like, is that too much? It's never too much. Give me the information. And then they open up a bit because you start with physical. And it's easier than if you started with emotional because that would be harder to open up, right? So educate the patient and tell them that the more you know, the better. And that normal to them may not be a sign of being balanced and healthy. So think of those symptoms and all the stuff you share with me that may feel normal, right? It's kind of like that little tick, tick, tick in the car. And you're like, I don't know where that tick comes from. And you keep ignoring it until the car breaks down.
That's right.
That's the same thing. So use those analogies. People totally get it. If you still struggle to come up with the right treatment protocol for your patients, you are going to love my third book. By popular demand, I have created a guide for TCM treatments for over 160 common syndromes with acupuncture points, herbal formula, ear points, diet, and so much more, including
many of my clinical pearls. It is the game changer for acupuncture students and specifically for practitioners. You can download the digital version on any device, and it comes with many video links to complement it. Or if you're like me and you'd rather have a hard copy version, the publisher ships it all over the world. But before you invest in my Chinese medicine treatments made easy, I want to make sure it's everything you were looking for so you can download a sample of it. Listen to what people who invest in this book had to say. Thank you, Clara. This is exactly what I needed. I love how you organized this book. It's truly helping me in my first year in practice. Yay! So excited. Bought it immediately. It will be a great resource for studying for boards. That's awesome. Oh my God, I immediately purchased this, and it is such a bargain price that I almost feel ashamed for paying what I believe is worth of much more. Even as an experienced practitioner for over 10 years, I like your stuff just as much and benefit from it. Yay! All this is just so rewarding for me. So I hope you get your copy if you don't have one. The link is in the show notes below, or you can go to my website, acuproacademy.com, and click the shop tab on the menu bar. You won't regret it. I put so much heart and soul in it. I hope you enjoy it and benefit from it, and in turn, your patients do as well.
Going back to trauma, can you please enlighten us in traditional Chinese medicine perspective how acupuncture and herbs affect people who have trauma?
So acupuncture is going to release a lot of blockage. It's a really good tool for trauma. If you look at the ghost points, there's a lot of ghost points that are very specific to certain trauma. Since we were talking about sexual trauma, bladder 62, for example, is the ghost points that address someone that has anxiety as an adult due to sexual trauma as a kid. So it's not easy to use that point because not everybody's going to share that, right, with you. Oh, I had sexual trauma as a kid, but they will share the anxiety. So you're going to start with your anxiety point, maybe when 17, PC6, Heart 7, whatever you want to use for anxiety. And then eventually we can ask a bit more question a few weeks into it. So you've had anxiety since you were a child. Did something bring it on? Just ask that, right? And maybe that they're ready to share. And now you could pick bladder 62 because you know it comes from sexual trauma. I think acupuncture is really good in releasing. I've had patients crying for days when I've done some points and couldn't stop because it needed to come out. I think herbs are really good in addressing more physical than emotional. However, some herbs can calm the mind enough. And then you do acupuncture, and the acupuncture help release whatever needed to be released. Because sometimes the mind is so clouded with years of phlegm. And if you allow the herbs to help the anxiety, the phlegm in the mind, and allow clear mind, which some herbs are very good for that, and go to the root of the problem, let's say blood deficiency or whatever the problem was, then your acupuncture is going to help release it much faster. So it's kind of like hand in hand, right? So that's how I see it.
So my next question is like, what are the common patterns that we see with people with trauma?
So with women with sexual trauma, there's going to be some kidney issue. So kidney deficiency, because that's the shock and the fear, and it's affecting the reproductive system, which is all kidney. So there is going to be some kidney deficiency. It could be kidney qi, kidney yang, kidney yin. So it will affect the reproductive system because that's kidney, right? The second one is because our trust was broken. We trusted that we were being safe. And suddenly we were not safe because there was a trauma. There is constant fear, so that affects the kidney. Because it's been there for so long, the heart mind is affected. So there is going to be either, it could be heart fire, heart blood deficiency, it could be phlegm in the heart mind, it could be phlegm fire. So no matter what, it's going to affect the heart in TCM. So there could be many patterns. So that's like a heart and kidney disharmony. Your safety is your kidney. That's your root of who you are. That's your safe thing. And then your mind gets affected. So the two disconnect. So there's definitely always a kidney and heart disharmony. So that could create anxiety, insomnia, obsessive compulsive disorders, could create a lot of issue, but the heart's definitely affected with the kidney. And then the last one is there's going to be phlegm, because if you haven't dealt with it, you are going to have clouded judgment. Let's say that person that abused you is gone. They're either in jail, dead, whatever, they're not around. You're still going to have that fear. You're still going to have that clouded judgment where you still don't feel safe. Your brain knows this is safe, but your heart can't go to it, right? So that's using the 8 extra vessels. The 8 extra vessels, specifically the dye meridian or the dye vessel, is our belt. It holds all the other meridian in place. So when there is feeling of unsafety or we don't feel safe, we have to do dye vessel points to get that back into safety net. So gallbladder 41, for example, is a really good point for that because it's the confluent point of the dye vessel.
That's very good explanation. Thank you. Your education, basically really helps me to kind of understand it more and understand it better, clearly.
I don't know if you know Yvonne Farrell. She is the one that I learned everything from the 8 vessel. She's the 8 vessel queen, and she actually has a book on the 8 vessel for emotional trauma. You would love that book. And she has courses on emotional trauma with the 8 vessel, and those are the courses I've taken. So definitely look up Yvonne Farrell, emotional trauma, 8 vessels, because you're going to love that.
That's actually very nice. Because my next question will be, what is your advice on a current student like me who wants to focus more on reproductive or fertility health?
So if you're going to go on reproductive system, you want to take all your continuing education on those subjects: fertility, gynecology, pregnancy, whatever you feel like, really resonates with you, and trauma, because you're really focusing on that as well. That's the first thing. The second thing is watch YouTube videos on fertility. Really familiarize yourself with how the body conceives, what exactly happened, how many days does the sperm last in the uterus when someone has intercourse. Because you can educate your patients and say, listen, if you guys are going to have intercourse around ovulation every 2 days, it's better. Why? Because the sperm takes 48 hours to regenerate. So you would have semen, but no sperm in it if you do it every day or twice a day. So do it every 2 days so you have stronger, better sperm, right? So when you explain that to patients, and I don't think we learn all this in school, so it's good to really educate yourself into understanding the reproductive system so you can in turn help your patient understand the basics of what the mechanism is when they're trying to conceive, for example. Start also learning about reproductive therapy, because some people are going to use assisted reproductive therapy like IVF or IUI or egg donor. All those, it's really important to understand, because some patients will come and see you. For them to trust you to help them, it's important that you know what is IVF exactly. Really understand what happens. Because that way, when your patients go through it, you know exactly which stage they are in, what is occurring, and what you as a practitioner can do. Because supporting patients doing assisted reproductive therapy, acupuncture is fantastic. We have such a big role in supporting patients. And if they're going to spend thousands of dollars in those therapy, adding a little bit more for acupuncture will really increase their chance of success. So it's important that you know all that stuff so you can help your patient as well.
My next question is going back to treating people with trauma. I know that our treatment, especially in traditional medicine, is tailored to each person. But do you have any approach or step that you will do when we first see a patient with trauma?
So they actually came for that. That's on their chief complaint. Okay. So if that's the case, I'm going to start by obviously sitting them down. And because they came for this, I'm going to ask you a lot of questions. The more detailed, the better for me. Whatever you feel is right to share at this time. As we go, if you want to share more, totally. You have to take the time to trust me, and that's okay. Right? But the more detail I have, the better I can help you. And not only that, but please ask me questions. How is this going to help you? What is acupuncture going to do actually, right? You really want this to be an exchange, not just I'm asking you questions, you answer them. It's like there's an exchange. You can give me something, I can give you something, and let's exchange and educate the patient. So If they came and said, I've had years of anxiety because sexual trauma when I was growing up for like 2.5 years, I'll ask the question, have you had counseling? Have you had support from your family? Were they supportive? Have you told people that you feel safe about? Are they there for you? Like, what kind of support do you have? Because it's really important that patients don't feel alone, right? And then it gives you clues as well what's going on. What does that manifest with you? Are you able to sleep? I had a patient who was sexually abused when she was 16. And when she came to see me, she was 42. And from 16 to 42, every night she wakes up with nightmares, never went away. That's a long time of having nightmares and waking up every night. She's scared to go to sleep every night because she knows she's going to get a nightmare. That's crazy how long this poor person could not sleep, right? So you want to know those things. How does that manifest with you? Do you get a lot of anxiety? Do you feel like a pit in your stomach? Do you feel like you just need to eat your feelings? What does that look like? You bite your nails all the time when you feel anxious or when you feel nervous. Like, do you feel safe? Ask all those questions. Because patients will share, right? How does that manifest physically inside of you? Is this person still around? Are you worried about this person? Does it make you sick to your stomach? Does it give you shivers? Does it give you a headache? And then ask all those questions because that's going to help you figure out what are the physical reactions this person is going to have. And is it affecting the digestive system? Because the pit of the stomach, the eating, whatever, is it affecting more their heart, the anxiety, the insomnia, the mind? Is it affecting their liver because they're constantly angry, but they're not showing? It's repressed anger, which is even worse because we're not expelling it. We're not expressing it. It could be the fact that this person has thyroid issue because they never voiced it, right? And it affected the thyroid because the thyroid is our voice box at the same area. So thyroid things are usually people that did not voice what they needed to voice, right? Does that make sense? It really validates people that you're here to help them, that you're trying to go to the root cause, that together it's a journey. We're walking this journey together. And the more support this person has, well, it's not something they're going to forget ever. But the idea is to help them support so they don't get physically affected and they can enjoy the rest of their life because they're supposed to enjoy life.
Every time you're talking, I'm always like very amazed. And when you try to connect every little things, it makes really sense. So it's actually really, really amazing. That's why I'm always like, wow.
And that's the thing. It's good to have that foundation from school, but your patients are going to teach you everything. And the second thing is follow your gut, your intuition, even though you have all this knowledge, your gut and intuition will tell you a lot. And a lot of practitioners will say, myself included, that your intention with each patient is more important than your point selection. If your intention is to help this patient process this trauma and release and cry, your point selection are going to do that because your energy and your intention as you put the needle is going to help that. It is really important that you also protect yourself. Yes, being healthy is important, but it's also important to protect yourself because I am a very sensitive person. And I remember when I was in school and this woman came in and she had had colitis for 20 years, where to the point where even coming to the student clinic, she had to have her husband map out all the public bathroom that they could stop at every 5 minutes to make it to the school so she could come to the school, and she may have to stop 10 times because that's how often her in-control diarrhea was happening. She had to stop working. This woman was completely depressed. Like, it was so sad. And her whole life was upside down. And I remember going home that night and crying because it affected me so much because I felt so bad for her. Going back to my teacher in clinic the next day and saying, I don't know if this is something I should do. I don't think I'm cut for this. I cried literally so much last night for this patient we had yesterday. And I don't know how to handle this because I want to help, but it's just taking me down. And she made a really good point. And she said, Clara, it's because you're focusing on the problem. Focus on the solution. You're like the detective. Yes, it's sad, but think, okay, how can I help this person? What can I do? What kind of point? What kind of herb? What could I educate this person with? Like, look for the solution. I'm like, oh, yeah. And now when I have patients, even though they have really sad story and I feel it in my heart and I feel sad for them, my first thing is, the poor person, how can I help them and make them feel at least a little bit better? That's my job. Then it doesn't affect me as much and take me down. So because you're going to deal with trauma a lot, you need to understand self-preservation in order to give to your patient.
That's actually very nice. I understand that being empathetic to your patient is important, but I think setting the boundaries to your emotion as well to protect yourself is also very important. So I really appreciate it because I know you love Ghost Point. I watch your video, I read your book. Can we talk about more Ghost Point when regards to treating trauma?
The ghost points in general, they're very powerful. So I wouldn't put too many ghost points in one person. Usually one would be enough. If you want to put 2, 3 maximum, depending how strong and weak the person is. If they're very deficient, one's enough, right? If they're excess and they're big and they're strong, you can put 2 or 3. But it's always good to start with one just to see what happens. That's my theory on that. So because we were talking about bladder 62 earlier, which is one of the best points when there's anxiety as an adult due to sexual trauma as a young person, that is a really good point. I've had patients seeing literally different lights in the room with this point, which I have never seen as an acupuncture patient.
Yeah, I remember you told us before that you treated a patient and she saw a blue light.
Yeah. I come back and she's like, do you think I'm crazy? I'm like, no. But there was a blue light the whole time. I'm like, there's no blue light. So she goes, I'm crazy. I'm like, no. You're feeling such an emotional release. It's coming out in colors. Like I've seen colors before, not with acupuncture, but with meditation. So I know it's possible to see things. And it's really cool, actually, because it was a really good light. She loved it. She thought it was beautiful. Another point that I think is really important and key is pericardium 7, because it's for broken heart. And we think of broken heart often as someone broke up with us, like our romantic relationship, and someone broke up and they broke our heart, or they cheated on us and they broke our heart. Absolutely, this is a great point for it. However, our heart can be broken because someone really hurt us. They were our best friend and they said something really mean and walked away. That's a heart broken from a friendship. It could be heartbroken because you were feeling safe with that person and they literally betrayed you by abusing you. And then suddenly your heart got broken from the fact that you trusted this person. And then they went and took that trust away. They broke your heart. So we have to think at heartbroken, not just romantic heart, grief. That is broken heart. If you lose someone, let's say you lose a child, that's a broken heart. Pericardium 7 is very useful in clinical practice as well for broken hearts. I love to use stomach 40, even though it's not a ghost point. But stomach 40 is really good for anxiety and phlegm in the mind. And if there is emotional trauma, there is phlegm. If someone has a lot of anger and they cannot let go of something, large intestine 11 is a really good point when you're so angry that it actually affects your bowel, like you have diarrhea, a lot of anger due to the fact that you were abused, let's say, right? So that's a really good point as well to just kind of let go because we're holding on, large intestine. There's one that I like, which I've used over the years, which is REN 24. REN 24 is a ghost point for people that never ever smile because it's right below the lips. Where it's located, it's the smile point. When someone never laughs, never smile, and is consumed by dark thoughts, and that can happen again if you've been through trauma, you lost your sense of joy completely. You don't smile. Someone says the jokes and you might say, that's funny, but you don't smile. You don't laugh. There's nothing. So bringing that joy back, that sense of laughter or smile, REN 24, fantastic ghost point for people that just have lost that.
Thank you so much, Clara, for your time and spending every details that you can tell me. I really, really enjoyed talking to you. Like every time I talk to you, it's like a conversation, but I'm constantly learning. So I'm really, really happy to follow you along in your videos and reading your books. Because your books is so amazing, easy to digest, easy to understand. I'm really, really grateful for having you.
I'm grateful we met because you're awesome. I think you are going to be an amazing practitioner. You already want to help so many people, and the field you're going into is going to make such a difference for all your patients, and you're going to learn from them so much. It's going to be such a great journey for you and your patients. So I'm so glad you're going into this. You're awesome. You rock.
Thank you so much for spending your time with me today. I truly hope you benefited from this episode, and I would love for you to share it with a friend that may benefit from it as well. Follow the show, leave a review, and if you want more, go to my website, acuproacademy.com. I have tons of resources there with treatment protocols, case study, free courses, and so much more. And connect with me on all social media at Acupro Academy. I'm on YouTube, Instagram, Facebook, X, Pinterest, and LinkedIn and TikTok. And no matter what, keep rocking it using TCM. Please listen to the disclaimer, because the AcuPro Show podcast and material shared through AcuPro Academy, which is a subdivision of Natural Health Sense Incorporated, are designed solely for educational and entertainment purposes. The utilization of information from this podcast or any associated material is at the user's discretion and risk. This content is not meant to replace the guidance of an acupuncturist, Chinese medicine doctor, medical doctor, physician, or any qualified professional, nor is it a substitute for proper diagnosis or treatment. Users are strongly advised not to ignore or postpone seeking medical advice for any existing medical condition with their healthcare professional regarding any health concerns.